everybody. Good afternoon. You guys can do better than that. Good afternoon. Thank you. I know, it's a little tough after lunch, but we're going to get through this. So I'm Tetu, Espere, and I am a program associate for the Institute for Public Health Innovation, which is a public health nonprofit institution that is for DC, Maryland, Virginia. We're part of the NNPHI, so the National Network of Public Health Institutes. And I'm from the Richmond office. So what we were finding when we were working on, especially here in Richmond, but also in DC, Maryland, Virginia, is that between the 3 states and territories, there was a lot of silos going on between different strategies and ways that people can address health inequities using policy-driven solutions. So what we decided we want to do at PHI is start a webinar series. Woo! So our webinar series is called the Equity Equation. And what is the equity equation, you might ask? It is data plus policy plus community perspective. So our webinar series brings 3 speakers together, again, one each representing each part of that equation. They each present for 10 minutes, and then we do a Q&A with our audience. And then following the webinar, we also do a webinar debrief, where we allow audience members to come off mute, share some of their strategies that they're doing within their areas of work, and to start kind of networking. And so what we're doing with these different pieces of the equity equation is usually for the data, we bring in someone from research, from academia, who can kind of provide a context to the health inequity. So far, we've had 2 webinars. The first one was on the decline in life expectancy in the DC, Maryland, Virginia region, and the second one was during Black Maternal Health Week, of course, on Black maternal health and Black maternal mortality. And so we brought together researchers, and we brought together community-based organizations, thank you, and then we brought together people, legislators as well, so policymakers. So what I'm asking you guys for today is to help support this webinar series. It's currently unfunded. It is a passion project for me and my team at PHI. And so I'm asking for potentially funding if you might be interested in this, as well as I'm asking for any type of support to share the webinar with your networks, to maybe be a speaker yourself. Like I said, the ones we're planning coming up are actually on gun violence, climate change, as well as mental health. So if you feel like you're in that sector and you want to share your experiences and your work that you guys are doing, especially around strategies to address these health inequities in our area, then I would love to talk. So thank you so much.